All right. Good morning, everybody. Thanks for showing up after the AAMI party. I imagine maybe half the room would be filled because of it, but that was a great party last night. Well, I'm here to talk to you today about how we can think about growing the HTM profession as well as our businesses by thinking beyond our traditional sense of HTM. And in my introduction, they talked about dental. And these are some industries that sometimes get overlooked, and I'm going to challenge us today to look at these kinds of industries to even grow our own businesses within. But before I begin, I also want to give a little bit of a shout out to yesterday's keynote speaker, Aaron Horowitz. He had a great conversation about empathy, leading with empathy, and his drive as to why he built his business. And one of the things he asked us to do was to write down something that drives us and gives us passion every day we come to work. And one of those things for me that I wrote down was I'm here to advocate and increase the awareness of the HTM profession, both externally as well as internally. And that's where this whole dental is also medical kind of talk comes from at sometimes. So to give you a little bit more of my why, I'm going to give you a little bit more about my background. A couple of years ago, I was washing some dishes, because in my house, I love to wash dishes. I'm very particular about it, so I don't let my wife touch it, and we get in arguments all the time. But there was a little bit of grit that was on a knife. And I'm one of those ones that I like to get all that stuff off before I put it in the dishwasher, and I was working on it, and my finger slipped off, came back on, and I cut my finger extremely deeply. And there's still a scar here today. I doubt you can see it, but it was bleeding so profusely, I didn't know what to do. But immediately, I just grabbed a towel, I wrapped my finger, and I drove 3 minutes down the street to this urgent care. I got there, was seen by a doctor, they washed my wound, gave me medication, and they got me on my way after a $20 copay, all within under 15 minutes. This is the state of healthcare today for many of us. Fast, affordable, convenient, this is what we want as society and where we are going as society. And as healthcare in the model changes into where we get our patient care from, we have to meet that as the HTM professional. And that's what I'm here to talk about, how we think about that and how we challenge that. So a little bit more about me. I'm a biomedical engineer. I went to Texas A&M University. I have a master's in it. Oh, thank you, whoever's out there. And I have my MBA, all from Texas A&M. And yes, I'm a huge college sports fan, so I'm used to constantly being inflated about how great we're going to do this year and always being disappointed. To be fair, I think that resilience and that optimism is what made me a good founder for UptimeHealth, because it hardened me to always get through the next obstacle. And at UptimeHealth, what we've done is we've created software and technology to help these outpatient-style providers that are growing very quickly manage their equipment, but also do it in a way that is more helpful for the HTM community as well, giving them access to service, letting them know who to go to for repairs. And it's this work that we're doing that is moving us forward into how we think about expanding the HTM market. And this talk today isn't about my company. It isn't about my particularness about my dishwashing. It's really about challenging guys to think about how to look at healthcare and making sure we're building our businesses to meet the market where it's going. Where I learned about healthcare and where I learned about clinical engineering management was at this building. This is one of the Seton Healthcare buildings. It was, I think it's demolished now. Someone could probably verify that. But back whenever I was working at TriMedics, this is one of the buildings that I worked out of in the basement, and I learned everything there was to know about clinical engineering management. And that was because my colleagues, they loved and embodied the profession, and they talked to me about what it means to be an HTM professional, do things in a compliant way, and how much it matters to the delivery of healthcare. And it wasn't just them, it was also the group of technicians and the team that I was leading that helped me go on ride-alongs, understand their challenges every day, understand what it took to really put equipment back into action. And even if they were frustrated, you could see this sense of pride about the work they were doing and making sure that equipment was always fixed so people could get the best healthcare that they could possibly have because of quality equipment. And this helped change my understanding of what healthcare was and how it's delivered and the parts that are important to it. Because when I grew up, I was fortunate enough to grow up in a house full of providers and doctors. And even my aunts and uncles, and they would come, we'd have dinner, we'd have talks and conversations, and they would talk about healthcare in a manner when they did their medicine 20, 30 years ago through school about being a very deep relationship between a patient and a provider. That was what healthcare was. Learning about the patient, learning about their medical history, and creating a treatment plan that was best for them. But in this job, as a clinical engineering manager, and learning through my technicians and my colleagues, I started realizing that this was not a complete equation. There was a third variable that was missing that was vital and continuing to be more and more vital as healthcare delivery changed as well. And that was the equipment variable. Today, it's almost impossible for any of us to get healthcare without some instrument or device involved. And I think everyone in this room can agree with that. That's why we're all here. But it's the profession sometimes that overlooks this third variable. They sometimes take it for granted that it's there, it's active, it's working, it's ready for them to use when their patient walks in the door. And so I took this equation back after I've reimagined my understanding of what healthcare was to my family, and I said, why was it when I was growing up that we never talked about how important equipment and advancement in equipment was to delivering better healthcare? And to be honest, it's not like they had any animosity against it. They just didn't think about it. They just expected it to be there. They sometimes forgot that this was another driving force of how we're delivering healthcare today. And I think this is why, for me, it's important to continue to increase awareness, even to people who know that it's vital to the way that they deliver care, that we as the HM community are here to support that third variable that's often forgotten. And I'll tell you, all of them are very receptive. Like, you know, we should be talking about that more. I never thought about that. And luckily, as their son, I made them talk about it. And so now they're advocates for the HM community. And it's not just the care delivery that's growing and how we're changing and using more and more equipment. It's where we're getting our care. We talked about, I just got my care at that urgent care earlier. But as a society, we're finding that the business model for how healthcare operations run involves a lot more outpatient, ambulatory, post-acute, and now even in-home healthcare. And this isn't slowing down. More and more patients are now being seen in these other areas, in other buildings than ever before. And if we think about that, and we say healthcare is now being provided in places away from the health system, that means, according to the equation, equipment is being pushed in these different directions, further and further away from a highly dense building that has a basement full of technicians and parts and know-how into these very harder to reach areas. And it's not slowing down, it's only growing. It's only getting harder and harder to support equipment as we as a society are consuming it in different locations. And it's not just hard to get to, but it's how we have to operate as the HM community that's also going to fundamentally change. And we have to challenge ourselves to meet the market where it's going. Because it's no longer, as I mentioned, people in a basement going floor to floor, parts access relatively readily available. Now you're in vans. You're driving. You have windshield time. You're usually finding point problems. When you go to an outpatient location, there might be one broken machine, not multiple. So it's inefficient in our minds. And I think that creates this resistance for us to want to move into this direction, even though healthcare is already going there, whether we want to or not. And I'm here to challenge you today to continue to think about this as a way to expand your business and really pay attention to this world. And if you don't believe me, let's look at data. I'm an engineer, so I love numbers, and I love boring charts. But on the left-hand side here, we have the inpatient volume over the past 15 years. I got this information from the AHA, so it's the best information I had. But you can see over the past 15 years, the number of inpatient visits has been pretty steady. This is counter to what we should intuitively believe as we have an aging population that should be getting more and more healthcare. That's because on the right-hand side, we're seeing people get their healthcare in the outpatient settings. It's affordable, quicker, more available, and we want that. So the trends are here. We as a society are already going this direction. We're going less and less to the health systems. And then let's get revenue. Dollars speak, right? Where dollars are is where innovation is, it's where growth is, it's where attention is put, and so we're just going to keep going because that's where the dollars are telling us to go. And in this revenue chart, again, AHA, same data statistics, in 2019, it was the first year in history that outpatient revenue surpassed inpatient revenue. Think about that. This didn't happen decades ago. This happened 5, 6 years ago, right before COVID. And the trend's not stopping. More and more revenue will be put in these locations. And again, what does revenue do? It drives innovation, drives thought, drives progress. So that's where the market's going, that's where the data's going, that's where we need to go to meet it. But I'm not here to talk to you about urgent cares or ASCs, because to me, we saw the health system model that is naturally expanding to these worlds that are going to take us along with it, right? Because we work sometimes for health systems, so organically we're going to find ourselves in these locations, whether we want to or not. What I'm here to challenge you to do is not just look at these industries as a place to grow your business because they're hyper-growth. It's to look at it in a different way and to take a step back a little bit and think about what HTM means in a holistic level and take that step back both figuratively as well as literally. Because look at the same complex I looked at, and I went to get my care. What do you see? On the left-hand side, we have lens crafters, where people get eye care today. On the right-hand side of that urgent care, you have a laser hair removal place. That's dermatologic aesthetic care. Outside the frame, but you might be able to see on that marquee post, is a physical therapy location right next door to laser hair removal. And in the reflection of the laser hair removal is a pharmacy. All of these places are places that we go get healthcare at. And where there's healthcare, there's equipment. And that means opportunity for you guys. And it's not just these locations. We can think about building our business without leaving the parking lot of a place that is currently inefficient to go service, right? So instead of going to this one place and only finding one thing, maybe you can pop over to the left and right and grab more business to make that truck roll less expensive for you. And it's not just the ones that I'm mentioning here. Think about all of these locations, people that provide care that don't have an in-house biomed today because they're in a different kind of location that's outpatient. Two of the other biggest ones that we might all look at today is veterinary. Patients are animals, yet they require equipment to take care of them. I have 2 dogs. They're really expensive. One of them goes to the vet every other week, it feels like. And all the equipment they hook her up to, it feels like this is the same thing that we see in the hospitals every day. But also dental. To Robert and Danielle's introduction of me, this is an industry that we're hyper-focused on because of how quickly it's growing and how the trends in the industry are also moving us this direction. Again, so why does this matter? Every one of these locations has equipment, opportunity, and growth for everyone in this room. So let's look at some more data, because I love data. And let's talk about the word growth. In this world, growth can mean net new location building, right? We are adding more of these healthcare locations to grow our ability to consume healthcare. So in this chart, in the orange and, I should have used better colors, I'm realizing. In the orange and yellow, we have urgent cares and ASCs. Sometimes when I say it's traditional, things that we think about when we think about outpatient ambulatory care. The other 3, eye care, dental, veterinary, are some of the other places many of us in this room probably go to get healthcare, but we don't think about as traditional HTM or traditional healthcare. And look at their growth rates. Veterinary and eye care grow at the exact same rate as urgent care, and yet many of us believe urgent care is the fastest growing industry in healthcare. But above all, look at dental. It towers above the rest. It averages 1,500 locations every year being built. Can you believe that? I didn't believe it. I had to relook at that data multiple times before we entered into the dental industry. And to put the growth into perspective, I'm going to pull up 2 iconic brands that many of us all know here. You have McDonald's, which is highly regarded as one of the fastest growing fast food chains, creating more healthcare for us to consume. One of the fastest growing fast food chains ever. And in its heyday, in 1 year, they built 600 locations. In its heyday, best year ever. That's equivalent to the number of average urgent care, veterinary, and eye care groups that are being built every year. So yeah, fast growth. What about Starbucks? You can't go a block without seeing a Starbucks. Well, in Starbucks' heyday, 1,400 locations were built in a single year. Going back to dental, 1,500 every year on average for the past decade or so. So when I think about high growth, this is what I mean by high growth and where we should put our attention and our focus, because that's where we're going as a society. So before I begin in my talk, because the rest of my talk is going to be how do we evaluate some of these other industries and how do we maybe break into them if we'd never thought about them before, because I think that's part of the struggle and the problems. I want to ask a question just generally, or maybe for you to self-reflect on, but how many of you in this room have been asked to service equipment outside of your norm, either eye care, veterinary, or dental, the 3 ones that I'm talking about here? Many of you. And maybe they found you on Google. Maybe it was a friend or a family member that said, oh, my friend, they're biomed, they should be able to help you out. And many of you probably couldn't actually support them because you don't have the training or know-how or have never been in those offices before. And that's an obstacle that we all need to overcome. And maybe some of you are good enough friends and like, let me just go take a look. What's the worst that can happen? And you might find a chair that looks like this. And this is an exaggerated AI-generated image. I'm trying to use as many AI-generated images nowadays as I can to reduce any kind of sourcing problems. But this is maybe an exaggeration, but not far from the truth of what people might see, especially if they go into rural and hard-to-reach areas, because people are doing it themselves because they can't find help themselves. And so let's take that step back again. Why am I being asked as somebody that they know that can't support this equipment to support their equipment or help them out? Or why are they doing it themselves? It's because they don't know where else to go. There's not enough of us paying attention to these kinds of industries to support them. And that's the challenge I'm asking us all to rise to today. So when we think about entering a new market that we might have never thought about before, there's 3 things that we're going to evaluate together, and it's going to be a general exercise. And we are going to look at how do we think about marketing, like, is there a market for us to be had? Is there some unmet need that we can match? How can you prepare for a market, especially if you don't have training or education? Where do I go to get that kind of information? And lastly, how do I break into the market? So if I am prepared and I know there's capability, how do I even sell or grab my first customer? So these are things we're going to talk through the rest of this talk, and hopefully get you and your juices going and your mental kind of turning around and saying, I can do this. All right, and lastly, that does answer my next question is, should I do it? Just because there's a market, just because you can, should you? All this has to do with your passion, your why. Going back to Aaron's conversation the other day. If you don't have passion to enter in a new market, don't do it. But let's see if this actually does get you on your feet to say, maybe I should. So how do we look at this? When we think about market, we look at supply and demand. Is there a lot of demand for my capabilities, and what is the current supply to manage it? So let's do this. Let's do this for the dental industry, because if we look at the demand, and we think about demand as total addressable market sometimes, how many dental offices are there today in the United States? Did you know there's 150,000 dental offices in the US alone? I didn't know that till like 3 years ago. That number was crazy to me, because there's only 15,000 urgent cares in the US. To put that into perspective, that's a 10 times market. And if you stack veterinary, who has about 40,000, and eye care, who has about 30,000, on top of the traditional medicine that we think about in the outpatient and ambulatory spaces, you don't even get to half the dental market. So when we think about demand, dental might be a good place to find some demand. All right, let's dig in. Imagine you are a ISO or a biomed group that services the Houston, Texas market. I'm just going to give you a framework and a way to think about this demand. I picked Houston because this is where I'm from. I know for a fact I can't throw a rock without hitting some kind of healthcare provider. So I know there's a lot of opportunity here. But let's look at this opportunity in terms of this context. Right now, assume that I work for health systems or clinical, maybe CHCs, and I treat ambulatory, such as urgent cares and ASCs that are independently run, as my growth markets and my growth opportunities. And if I look at the number of these locations in a 45-minute drive radius, because I don't want to drive too far, Houston, Texas traffic is terrible, and I can't ever predict I'm going to get home, there's about 190 urgent cares and 130 ASCs in that organization, in that location. So that's about 320 opportunities for a growth market for my business. But maybe I want to open it up to something I never tried before, like dentistry. How many dental offices are in the same 45-minute drive radius? Well, there's over 220. So that means to grow my business, I could potentially increase my opportunity by 40% without increasing my coverage radius, which today is the most expensive thing you can do to grow your business. It is one of the best ways to grow your business, so I'm not saying you shouldn't, but you think about it. When you add coverage radius to grab just as many ASCs and urgent cares to equate to the number of dental offices, you decrease your response time, you increase the time in the windshield, wear and tear on your vehicles, and potentially having to hire and recruit in territory so you can be more responsive in local areas, which decreases the density in your ability to work together with some of your other biomeds that you're hiring to grow your business. So it's a great way to grow, but it's one of the most expensive ways to grow. So that's why I'm saying challenge yourself to say, can I just grow in the same market? And sometimes in the exact same parking lot. And then you can think about demand, about who is asking for my help and what are they asking for. Luckily at UptimeHealth, we've done this homework and research for you. The top 4 things dentist offices look for when they're looking for a biomed is, can you be reliable? Can you be on time? Are you affordable? And can you help me with my equipment-related decisions? Because all of these offices, they don't have a professional like you inside their office that's constantly telling them how to take care of their equipment, how to think about it. They need you as the external party to be that for them sometimes. But the good thing about all these is you might say, Jinesh, this is exactly what we hear in medical. It's exactly right. It's the same problem. You're not selling something different. You're selling a solution to these problems which you're already selling a solution to. Your only gap is you don't have access to the training right now. You don't have access to how to get into the market, but you're not selling something different or something that you're not used to selling. So let's look at the supply side, because I think we can say there's a little bit of demand, and the demand makes sense, and it feels familiar to us. On the supply side, this is the biomeds. Who is here servicing the industry? Today, and we're one of the best people in the industry to know this information, it is hard for us to pin down the number of technicians that are in the dental market today in totality. It is really tough. And I'll tell you why, because there's a lot of obstacles creating supply and understanding supply. But let's look at some of the medical stats and apply them to dentistry and then add those barriers so we can prove to ourselves that there's less supply there than there is in medical. We all know that there's an aging population, and it's a big crisis that we're all aware of that we need to get ahead of. And this information is from 2021. The average age of a biomed right now is in their mid-50s, and 60% of us are over 60, right? We've heard this time and time again. But in dentistry, there's even more obstacles. There is no, up until recently, there was no place to get education on how to be a dental technician without going and getting hired by a distributor or getting hired by somebody that has an in-house school to train you. So think about that. You had to get a job before you get the training on how to do the job. This doesn't make sense. But that was the barriers, unless it was the hiring practices of these distribution companies that limited the supply of the market, which is much harder to break into than, you have schools like CBET and community colleges that are actively creating more biomeds, whether there's a job or not, and we all know that there's jobs. But I'm saying we had avenues and channels and pipelines to create more, but not in dental, not until recently. So if you think about the supply and demand problem, there's not a lot of supply, there's a heavy demand. So you should ask yourself, is this a market that I should look into? Let's say you said yes. Now let's look at how to get prepared. When we think about getting prepared, 3 major things should come to your mind. How can I get knowledge about the industry and the equipment that I might find myself in front of? How do I actually get hands-on training and experience to support those equipment? We all know that's one of the most important things we can do. And then where can I continue to get further and further education so I can understand how these dentist offices are evolving, so I can understand the new types of technologies that might find themselves there, so I can prepare myself to enter that market. Because this is not a one-time decision. You're committing that this is a place I'm going to support, and I'm going to actively support over and over again. So let's get prepared together in the dental world. This is a typical dental operatory. And yes, we call them operatories in dentistry. We don't call them procedure rooms. We don't call them exam rooms. We don't call them patient rooms. We call them operatories. Nomenclature is important. And many of you might be familiar with this chair. You see it when you walk into a dental office. And if you haven't seen a dental chair in a while, go get a dental visit scheduled. Because oral health care is important. I want everyone to have good hygiene. But this chair sticks out, and it's mechanical, electrical in nature, and hydraulics. All that is something that you should know your way around. And the good thing is most times a chair is a chair. Even if the manufacturer is different, they're all relatively the same. But some things that might not meet your eye are these other objects in the room that need your attention. You have a delivery unit. These are the hand pieces that when they get close to your face and the whirring sounds, you get a little tense, or I do. That's what drives the actual dental care. And these are driven by vacuums and compressors. You have an exam light. These are the exam lights that heighten the area that they're going to maybe clean your plaque or find that problem area and do that procedure on. And they use the light to look at it. There's a patient monitor, where the dentist hygienists look at to see what they're working on, and they might look at you to say, hey, this is what we're seeing. Can we do the treatment? Are you okay with it? It's a monitor that they use. And lastly, on the corner is a CBCT, a cone beam CT. That's an x-ray unit. At the end of the day, after you look at this operatory, knowing that most of these are cookie cutter, this doesn't feel like a daunting industry to jump into, right? A chair, an exam light, a patient monitor. Maybe you need some specialized training for the CBCT, of course, but the rest of it should feel approachable. And let's look at 2 other places you might find yourself in a dental office: a sterilization room and a mechanical room. That sterilizer should look very familiar to many of you, especially if you already service an urgent care and outpatient location that has benchtop sterilization. That's a mid-mark M11. So the manufacturers and the type of equipment we can see in these new opportunities sometimes are the exact same that we're already seeing in medical. So you might be able to jump into this industry without even having to get net new knowledge. Then you have a mechanical room that has a compressor and a vacuum. And all of you are technical and mechanical in nature. So what is a compressor and what is a vacuum? We know that at a fundamental level to not be a super complex device. All we need to know is how that operates in the confines of a dental office. And we already talked about how that drives hand pieces and whatnot. But that's really the extra education you need. Otherwise, it's a compressor and it's a vacuum. So again, this shouldn't feel daunting to enter into as a market. And I'm trying to make that obvious to you guys in terms of like, oh, I don't want to learn this whole new skill set. Well, I don't think it's too far of a jump. And if you don't believe me, I've asked one of our trainers to give a little 2-minute video about how he thinks about this world, because he's been in this world for decades. He's now actively training biomeds into becoming dental equipment repair technicians. So let's see what he has to say. So this is Matt Lau, who's in charge of our training and education for bringing on net new techs.
AAMI eXchange 2025, so wish I could be there with you guys. Hey, for those of you who don't know me, my name is Matt Lau. I've been in the HTM world now for about 35 years. I did 22 years in the United States Air Force. 6 of those 22 years, I was the senior Air Force instructor for the DoD's biomedical equipment repair program. Once I retired, I have trained a total of about 300 people on dental equipment. So, can a biomed do dental? Dental equipment is medical equipment. I don't understand why there's a separation, but there's a separation. Can you guys switch over? Absolutely. It is a piece of cake. Why? You guys have the skill set already. You know what you're doing. You just need the exposure to the equipment. We can help you out with that. There's truly only about 30 pieces of equipment in the dental world that you need to become an expert on. The beauty of it is you get to specialize. You're not pulling out the manual every time you need to do a PM or a calibration. You learn it, it's all up here. You can go in and you can bang out repairs, preventive maintenance very, very quickly. The other thing is there is a lot of money to be made in the dental world. My company on the medical side, $159 an hour. Dental side, $189 an hour. So even if you are not looking to start your own business and you're just looking for, a company you need to go to work, we have multiple companies who are begging for technicians that we can help you land a job really quick. So if I can help you guys out in any way, please do not hesitate to reach out. And I hope you guys enjoy the rest of your weekend.
All right, thank you, Matt. So that was Matt. As you can see, he's passionate about this, and he believes it's easy, and he's lived and breathed this world. So I just, again, want you to hear it from people who might be in your shoes, how they think about this market. But we also talked about getting prepared, and I said up until recently, there wasn't a good way to get hands-on training. Well, we talked about this yesterday on the podcast, and I don't know if Monty's in the audience, but the College of Biomed Equipment Technology in 2025, so this year, created the first accredited program for you to receive a dental repair technician certificate. First time ever. So we're breaking down that barrier to access to training that we talked about. And there are manufacturers, and some in this room, Mars Biomed might be in this room as well, that are, there they are, there's Stu, that are actively donating scholarships to help increase the number of people that want to look at this market and make that barrier even less. If it's a financial barrier, Mars is here to help as well. And I want you to see this means it's a community trying to help you out, because CBET and Mars and other manufacturers are actively working together to create this curriculum because they see the supply need just as eager as you do. And so they're working to break it down and going to where we can get our future education on the market. Well, we heard Danielle and Robert earlier. In 2026, we're going to have a dental pavilion here at AAMI. So you can expand your business without leaving the parking lot. You can expand your knowledge without leaving the building. This is where we're all going. And this is where I want us to start thinking about accessing these non-traditional healthcare locations to support them. Everyone is here crushing those barriers today in the dental world. And this is happening in other industries as well. But it's up to us to get prepared, get that information, and get that knowledge. And I'm here to let you know that we're also at UptimeHealth here to help you out. So again, can I prepare for this market now? There's now a school. There's manufacturers trying to help me out. AAMI's coming into the game. It looks like the dental equipment's not that far of a reach for us to support. Should I do it? Let's say yes. Because the next thing we got to look at is how to enter into this market. It's easy enough to say I have the training, but how do I win business? That's the whole thing that makes us all drive, right? If we're not profitable, it doesn't make sense. So let's do an analysis together. And to do that, we should think about how we currently can go to market. In the medical world, this is the paradigm we sometimes see. I'm making a very simplistic point, so I know there's a lot of nuances. But in the medical world, traditionally, OEMs in the outpatient space can go through distributors to put equipment in these offices. But OEMs can also sometimes go direct, which means as a service providing company, you have to compete sometimes with the manufacturer as well as a distributor to win that new business. In the dental world, it doesn't operate this way. The OEMs never go direct. they go through distribution exclusively. So that's one less player you have to think about when it comes to accessing this market. And in fact, that's why OEMs are here to support your training and education. This isn't some right to repair debate. The OEMs are saying, you do it. Because we don't have an install army. We can't go direct right now. We don't have a service or warranty army. We rely on distributors and service technicians to do this work for us. So they're actively supporting and encouraging you to get into this market. That's a different paradigm that we're used to. And if we think about how to access and win this business, what we can do is a couple things. We talked about the supply problem. Well, that supply problem is global, even to the distributors. So there's regions of the country that they cannot manage today without your help. So you can partner with them and say, I work in a geography that you currently have no support in. Let's partner and I'll take those on for you. That's a way to get business. You can also knock on doors, phone call, right? The traditional way to get things, send out flyers. Now, one of the other ways to look at accessing new business, outside of the generic things that we're talking about, is let's look at what the industry's doing high level. Uh-oh. Sorry, guys. We have here what we call MDI. Let me go back. MDI is something that is happening across the medical and dental spheres, and it's all been happening the last 5 years. This is the combination of putting dental and medical in the same building for healthcare. And we can look at these trends happening. So even Harvard's medical and dental school has a track about the benefits of MDI and why it's important to put dental and medical care in the same building. Groups like Pacific Dental Services, this is a 1,000+ location, a top 3 dental group in the United States, in 2024 announced that medical care is going to be inside of every one of their dental offices. The CDC has been studying the benefits of disease prevention by having dental medical care in the same building, right? Everyone knows the plaque on your teeth is the same as a plaque in your heart, so you can get ahead of some issues. One of the biggest payers in the industry is creating business case models and case studies for you to absorb so you can learn how to be profitable with an MDI model. This is a payer saying this is how you become profitable with this model. And then you have research institutions like CareQuest that are actively involving themselves in the future of this MDI integration. So what I'm trying to say is think about this. As a biomed, this is an opportunity as well. Outside of just doing generic and general business building, some of my existing logos might be including dentistry in the very near future as an urgent care or whatever outpatient center there already is. That's where the trend is going. That's how healthcare is changing as it continues to evolve. And that means for many of you, you might not have to leave your logo to expand your market by just getting access to how to repair dental equipment. Or you can work with some of these bigger groups on the dental side that are trying to include medical to say, I'm going to be your single source vendor to do this work for you because that's an easier thing for us to manage as a business. So I'd much rather have somebody who could do both, if not all. And some of us, again, work with CHCs and hospital systems already that have dental equipment inside of it. And right now you might be outsourcing that to some of the distributors we just talked about. But if you could take on that business, you could do that right away. So I hope you can see that even accessing this market, although you can go through traditional means, it might be easier than we think. And lastly, how do we price ourselves in this market? Matt kind of talked about this a second ago, but for the same skill level equipment repair technician in dental and medical, we find from our data that on average, dental techs are able to command 20 to 50% more per hour in their labor rates. Same skill set, same skill level. We're not talking about level 2, level 3, some kind of specialty. They are the same. But why is that? It's because of the supply problem. It's a simple supply problem. With less supply, you can increase your pricing. But what that means for us in terms of opportunity is we can think about entering in this market by either playing our existing profit margin and saying, I'm going to come in at a competitive pricing. Remember the affordability thing that they're looking for. And I already know I can be profitable with my current margins. And I can enter in and win this on a price basis without really having to give up a lot of revenue or profitability in my current business today. Or you can say, I'm going to increase my revenue per head and grow my abilities anytime I enter in one of those doors. But you get the knob. You get the dial and how you want to change that. So there's a lot of benefits in terms of how to access this market and how we can turn these dials or attack new logos or look at existing logos. And then once we get all this information, we got to do our own ROI analysis, right? It has to be profitable at the end of the day. So what do? We look at profit per head. What is our new hourly rate? Is it the same? Is it increased? How much does it cost to deliver on that hourly rate? Then we look at all the cost, training costs, supply costs, marketing costs, sunk time, because the time that we're spending growing a brand new vertical is time that we're not spending growing a vertical that we know, live, and breathe. We should add all these costs up and understand how many hours at a profit margin do we need to finally get an ROI that makes sense and should answer that question, should I do it? So in this analysis, what we can do is say, on average, a dental office might command 6 to 8 hours of work from us in a given year. It could be all clumped up in 1 month, could be quarterly spread out. Sometimes it's more, sometimes it's less. And how many offices do we need to visit, knowing that, to break even from our cost? And depending on our geography, maybe we don't have access to hundreds and hundreds of dental offices, and maybe we only have access to a few of them. So we got to understand, how many years does it take if we can only win a certain number of offices? And make sure that this calculation makes sense for you, because again, this is going to be a long-term commitment, but I think it makes sense to start looking into with all the data that we have in front of us. And you can finally answer that question of, should I do it? So in summary, I want us all to think about this. HTM, in the traditional way we think about it, sometimes only thinks about medical in our existing business models with our existing healthcare systems and how they're expanding and our ability to support them. But when we go into the outpatient spaces in our in-home healthcare, healthcare looks and feels significantly different. Because everything in your hospital building is under one roof. You have dental, eyes, surgical, medical, you name it, it's all under that giant roof. In the outpatient spaces, they're specialized and localized. You have a dentist office, you have an urgent care office, you have an eye care office. These are all individual buildings and individual businesses. And sometimes we forget that. But yet, all of them provide healthcare, which means all of them have medical equipment inside of them that needs your support. And that's just where we're going, and we're going to continue to grow. We can look at all the data we want. And there's actively people in this room, whether it's us, whether it's AAMI, whether it's Mars Biomed, whether it's CBET, whether it's other manufacturers, that are breaking down the barriers that used to traditionally exist. And all this is happening in recent history. So again, 2025 was a school. AAMI's talking about 2026 for their summit. So the things that you might have thought about older industries from the past might have been true in the past. But today, the market's changing and evolving, and we can evolve with it. And we can look at these non-traditional areas to grow our business in. So I'm going to challenge everyone to think about doing like a 30, 60, 90 plan. I know we all hate these sometimes conceptually, but let's just do it for yucks to make sure that you have enough time to think about it. And in the first 30 days, I would like to challenge everyone to at least consider an industry that they might not have considered before. Just think about it. Maybe do some Google map search like I did to see how many of these kinds of locations live in my region, my location, my coverage areas, and pick one. Then do some deep research about that industry itself and say, are there market headwinds like MDI or something like that that is going to allow me to generate business here pretty quickly? Or how easy is it to access education and training to get good at repairing those devices so I can be a trusted and reliable source? And lastly, think about what it takes to go to market. How many of these businesses are in or could be in the same logos I currently do business with, or how easy to attain the next one? It's not a hard exercise, but I think it's incumbent for this room to do this, because we think about the healthcare technology management sector and our labor and our supply being, I'd say, under attack, but meaning in a crisis mode. But it's actually, we're on the greener side of the grass compared to some of these other verticals that are also providing us healthcare that we consume every day. And we need to make sure that we can continue to consume it in a reliable, protective, and quality way, because the equipment variable that many people sometimes forget, especially on the provider side in these smaller footprint buildings, it's up to us to come to the occasion and be there for it. I want you all to know, in this industry, it is my passion, but it's to remind you that you're all vitally important. Healthcare doesn't exist without you. You are absolutely needed. And we need more of you, and more of you thinking differently and expanding your own boundaries to support. And it's all because you protect that third variable of healthcare that we often forget. And I think sometimes some of our older generations who had medical school back in the 70s, 60s, like my dad did, who healthcare was a really good moment for a patient and provider to get together, but as equipment and technology evolved, it's become the only way we can deliver healthcare today. And you make sure that can happen. So I want to thank you all for your time and listening to me go over why it's important to consider non-traditional boundaries to expand our businesses, why we should look at healthcare as more than just medical care, dental care, eye care, vet care, dermatological care. Even med spas nowadays are growing like crazy. They have cryo units inside of them that need your help. We should be looking at these trends and actively addressing them so we can meet the market where it's going, because I don't want to be too late. As medical continues to move into our homes, that means equipment will find itself into our homes, which means it's harder for all of us to get to. We talk about drive time. We talk about windshield time. Think about the fragmentation of only having a couple devices in a single home, but you need to go out there to support it. We have to build a better model, and it starts with us looking at some of these adjacent industries and learning how to tackle them so we can better equip ourselves for an even more fragmented world, which is happening. So thank you again for your time. Thank you for listening to me ramble about why dental care is important. Please go get your teeth checked, because hygiene is quite important. And maybe while you're in there, you can look at the equipment inside of that room and see, is this something that I can take care of? And you should do this for everywhere you go in these outpatient sectors, whether it's getting your glasses checked, whether it's getting your pet taken care of. Look at the equipment and say, can I solve that? And why aren't we? Thank you for your time. If you want more information about how to expand yourself in these verticals, there's companies like mine that are giving you education and resources and places to go to. That's at booth 2628. Again, we're not here to sell you anything. We just want to help you think through this moment, because it's a pivotal moment in healthcare that we all need to get ahead of before it gets too late and we don't have enough HCM professionals on the other side. Thank you.